The Ayurvedic clinical protocol for managing obesity. Whatever I am going to mention in this session is from my clinical experience of more than 15 years in hospitals and in Ayurveda Gram in Bangalore, as well as my learning from my teachers and the Vedic texts. We have done, these type of protocols in hundreds and thousands of people. And in Kerala Ayurveda, in our clinic and hospitals, we are consulting and treating thousands and thousands and thousands of people in more than 30 clinics and 2 hospitals and Ayurveda Gram in Bangalore. We have a very good, clinical database, and we have, over a period of time, done fantastic clinical protocols to combat these digestive metabolic disorders. I will tell you some of my experience. If you look for external therapies from the Ayurvedic protocol, the best external therapy found to be Udvartana. Udvartana is massage with dry herb powders. We use different herb powders, including, sometimes we use Triphala powder, sometimes we use the barley powder or a combination. There are different types of powders, the herb powders available, which can be used for the Udvartana. A little bit about the Udvartana therapy. It is mentioned in almost all of the classical, the Vedic Ayurvedic texts. Ashtanga Hridayam, written by Vagbhada, says that, I'll tell you in Sanskrit, then I will explain you about the Udvartanam, this dry powder massage therapy. Udvartanam kafaharam medasa pravilayanam sthirigarana manganam tvak prasadakaram param. It says that this practice Udvartanam, kafaharam, it reduces the kapha. Kapha is the functional principle within the system that makes the system more sluggish, more sticky, more stagnant. So it reduces the stickiness in the system. It reduces the stagnation in the system. So Udvartanam helps in relieving the stagnation and the adhesive property and the stickiness in the system. It clears the channels. Medasa pravilayana. Medas means adipose fat, the fat tissue. Pravilayanam. It allows the adhered fat from the system to come to the normal metabolic cycle to get it reutilized. So it helps the adhered fat to come to the metabolic cycles to get reutilized. Sthirigarana mangana. It tones up the muscles, tones up the skin and tissues, gives better tone and shape to the system. Sthirigarana mangana. It strengthens and, tones. Tvak prasadakaram param. It clears the skin because it is exfoliating. The dry powder massage takes out the dead tissues and it clears the skin. Tvak prasadakaram param. It is ultimate in clearing the skin. What else you need from one single therapy of dry powder massage? It is done in a particular way in Kerala Ayurveda. We use it in all our clinics and hospitals and Ayurveda Gram. The direction of the Udvartana massage is opposite to the hair follicle, gives a little bit friction. There is specific pattern and pressure we use to get optimal result. That works very well. Another therapy is called Dhanya Amla Dhara. Dhanya Amlam means it is a fermented grains. We put different types of grains, including the rice, barley, millet, different grains with lemon and some dried ginger and some ingredients. We put in the warm water and keep it for fermenting in a particular temperature. Over a period of few days, this grain liquid will be well fermented. It is called a dhanya amlam. Amlam means sour. Dhanya means grains. It's a soury fermented liquid made from the grains. And we use that, the fermented liquid. That warm fermented liquid will be poured on the person's body as a continuous stream, the entire body. That helps a lot in, again, relieving the sluggishness, opening the channels, allowing the adhered fat to come to the normal metabolic cycle to get reutilized. That enhances the entire metabolism. It is good in various conditions, not only obesity, in various metabolic sluggish problems, circulatory sluggishness. It helps a lot in clearing the channels and toning the system. There are many other therapies and many other formulations and protocols available, which we have been using since thousands of years. And I myself, I have been using for more than 15 years in my clinical practice in India with excellent results. I would like to share all my experience. I would like to bring this to the entire world. That is the mission of Kerala Ayurveda Academy, to bring the authentic Ayurvedic information for the prevention and management of all health problems, physical, mental problems, and empowering the practitioners, educating the students, educating the practitioners in using the simple natural remedies to help the entire mankind. Let us continue this discussion. I will come to you soon, and we will bring more protocols, and we'll share our knowledge in handling various health problems in coming sessions. Please stay tuned. Kerala Ayurveda Academy is committed to bring the authentic Ayurvedic education across the globe. Thank you so much for listening to me. Namaste.